Hi, I'm Dr. Amir Karam, and I'm going to take you through a very, very important exercise. This is what I do every day in the office, or nowadays virtually, with patients who are interested in facial rejuvenation, patients who start to notice that they no longer look as young as they feel, and that disconnect is really at the source of what bothers them. And we're going to start looking at some of the anatomy that is behind those changes and try to understand, as a result of that anatomy, what is the rationale for the treatments associated with correcting those problems, and namely the efficacy of the vertical restore procedure and how it can address these things directly. So my patient here is a 56-year-old woman who has the general changes associated with early onset aging. And as you can see, she's a beautiful woman with a very, very pretty facial frame. The changes that are noteworthy, though, is that when she compares herself to what she used to look like, she notices that her face has become more square and less identifiable. And when you look at it more carefully, you start to see that it's not just the jowling that's the issue, because this is what really brings a lot of attention to people, as they say, oh yeah, look, my jawline is not what it used to be. But it's not that simple. The reality is, there's a downward drift of all the fascia from the upper brow region to the mid-face to the jawline and eventually into the neck, which I'll show in the profile view. But you can see in the temporal region, there's some hooding that happens right around the eyes. And that hooding is manifested, and a lot of people think that's because of the excess skin on the eyelid. But in fact, that's just the brow heading downward. And then the mid-face, as it heads downward, you can see this enhanced nasolabial fold and kind of thickness right around this region, and that's related to the mid-face drifting down. And as a result of that, the jawline starts to head south as well, and that causes this bunching at the level of the jawline. And the reason why this doesn't just keep going further is because it's being attached by some ligaments that are holding the bone in place with the soft tissue. So everything kind of folds over the bone. That's why we get this little dip here in this rounded jowling. Same thing with this region. There's some ligaments here that hold the midface up, and everything kind of falls over those ligaments. And as you can see, the overall shape of the face, as opposed to being the youthful heart-shaped that we're used to seeing and see in our mind's eye, instead the face becomes more rectangular. And as a result of that, it starts looking unfamiliar. So we see here on the profile view, you can really see this vector drifting down and causing the jawline to become more obscured, and the midface getting heavier with the nasolabial folds, and same thing with the side here. Now, when we look at it more carefully on the direct profile view, you can see again the outline of the marionette fold, but now you can see that the neck has lost its youthful shape, and it's no longer that crisp line that you probably had during youth. And all these changes in combination give the person some thought that, I no longer look as I did, and as a result, they seek opportunities to correct that. And so our obligation when we're trying to correct these changes is basically to make sure that the patient's facial shape is truly restored back to where it was when she was younger. So this is her in her preoperative photograph, and interestingly, in this photograph she actually has makeup, and in this photograph she doesn't. But it's remarkable how much more youthful her overall facial shape is, despite the lack of makeup in her postoperative view. But you can see again, when we follow these lines here, you have the presence of the jowling, the heaviness in the nasolabial fold, all these changes. And here instead you have this nice soft ovalization of the entire facial shape. The other thing that we did in this particular case, which added a lot to the overall outcome, and this is also a part of the facial aging process, as you can see, the upper lip has gotten longer with age. You can see the distance from here to here. And in this postoperative photograph, you can see the distance between her upper lip has been shortened, overall creating a more youthful overall facial shape, which is so important. And yet she has no evidence of being pulled or tight. And that's one of the beauties of the vertical restore, is that it lifts everything from the corners of the brow, the mid-face, the jawline, and the neck upward, so that there's a balanced, comprehensive look overall. And then when we see her on the profile view, once again, you can see the everything looks like it's being brought back this way. There's some important points to be made here. You can note that the structure of the hairline is identical to where it was before. The shape of the ears are the same as it was before, but you can see with the soft tissues all being rebalanced, jawline and neck, mid-face are all in a more youthful position. When we look at her on the profile view, same thing. There's a lot of action going on in here. There's a lot of breakup in these lines, whereas here there's nice smooth shape and contour, which is what we expect to see in a younger person. Again, on the profile view, hair is pulled back, no evidence of any scarring or lines, and this is 3 months after her procedure, and the anatomy of the ear remains the same with respect to the shape and the hairline and everything else that's going along. So this balanced, comprehensive approach is really what makes the vertical restore the unique procedure that it is. So that exercise of going through and analyzing the aging changes hopefully will be helpful for you at home. I think one of the greatest and most simple things you can do to identify whether you're a candidate or not is a simple test, which I'm sure you do this on your own, but it's basically where you put your finger on your cheekbone here and your thumb on the mandibular angle right here and here, and you'll simply lift upward. And when you do that, like in a case like this, when you do that, you will see the changes come forth with the effacement of the jawline, lifting of the neck, the effacement of the nasolabial folds as a result of that. And that's one of the criteria that you can easily self-assess to know whether you're a candidate for such a procedure. And if you are, really, there's no other way, there's no fillers, there's no non-invasive techniques, there's no lasers or energy devices that can replace a vertically based elevation and lifting of the soft tissues. And that's probably one of the most important take-home lessons, is that when you see these changes, don't be expectant that if you do some fillers or Botox or Thermage or some type of therapy or some other treatment is going to give you this level of correction post-treatment. Many times patients feel frustrated that they spent a lot of time and money and wasted a lot of it for results that they didn't achieve. So I hope you found this tutorial helpful. I think it's filled with a lot of good information and also an opportunity for you to be able to self-assess and help yourself get on the right track, as opposed to be in a position where you're unsure and unaware of what steps you need to take to be able to get the results that you're looking for, which to ultimately make you look as young as you feel. Thank you very much.